Bell's palsy versus CVA. How do we delineate one from the other? So, situation is, first and foremost, let's appreciate that in what Bell's palsy is, very briefly, it's an infection of the facial nerve. Again, recall facial nerve is one of the 12 pairs of cranial nerves. You've got one on the right, one on the left, and it exits the spine, or rather it exits the skull from the stylomastoid foramen just over here. Now remember again the mastoid process over here. If you have, while you're doing an examination on a patient for ear infection or otherwise cranial nerve, you've got soft, tender, red, swollen mastoid. You've got mastoiditis. That's an emergent referral A&E, referral to A&E, because the complication of mastoiditis is meningitis. Now going back to facial nerve, cranial nerve number 7. This originates in the pons, again 2244, forebrain pons, forebrain, midbrain, pons and medulla, cranial nerve number 1 and 2, i.e. 2, then the next 2, 3 and 4, and then 4 and 4, so 5, 6, 7, 8, and then 9, 10, 11, 12. That's your forebrain, midbrain, pons, medulla. That's a bit of recap. So facial nerve, as I say, comes out from the stylomastoid foramen just behind the ear over here, and it leads to 5 branches. Okay, the 5 branches that are, they come out like so, and you've got the temporal branch, followed by the zygomatic branch, followed by the buccal branch, followed by the mandibular branch, and finally the cervical branch, which innervates your platysmus muscle. Okay, so when we have an issue with the facial nerve, and don't forget facial nerve is both sensory and motor. The motor aspect is associated with some of the musculature around this area. The the sensory aspect is associated with the taste on the anterior aspect of the tongue, the 2/3 of the tongue. If we have paralysis, or if we have infection of facial nerve, what happens is we'll have a deficit in the functionality of the musculature in the face. So we'll have unilateral paralysis of the facial muscles, so facial paralysis. The question here is this a stroke? Or is this therefore a facial nerve palsy, i.e. Bell's palsy? And I'm going to now explain in a few moments how to delineate, but before I do that, I'm now going to remind ourselves that what a CVA is. So a CVA, cardiovascular accident, more specifically a stroke. Whether this is a TIA or a stroke. Now remember, the difference between a TIA, transient ischemic attack, and stroke is such that one, i.e. the stroke, the neurological deficit that is, lasts for more than 24 hours, as compared the TIA, which lasts for less than 24 hours. This is different. This is different from the previous guidelines that used to be, where we used to suggest that your stroke is essentially irreversible neurological deficit, as compared to TIA, which is a reversible neurological deficit. Again, from a clinical standpoint, appreciate the fact that your TIA, in textbooks, it lasts for about 8 minutes, the deficit that is, but in practice you generally see that for about 15 minutes on average. Okay, don't forget the phenomenon with stroke or CVA, this concept where you get a bit of a blind or curtain coming down the eyes, that can be unilateral or bilateral. It's referred to as amaurosis fugax. Now, when we get a CVA, this is a cardiovascular event occurring in the brain, a blood clot occurring there, and therefore causing an occlusion to the blood flow to part of the brain parenchyma. That will then reflect the actual motor aspect that area is supplying. So we have decussation, of course, remember, generally in the medulla, the kind of the pyramids that are, and so the left side of the brain will control the right side, and the right side of the brain will control the left side. When it comes to innervation of the face, or particularly the forehead, we have dual innervation from the brain. So from the brain, we have dual innervation. From the 5 branches of the facial nerve, we've got the temporal nerve, which innervates the temporalis muscle. So the one that enables you to clench your teeth, and when you clench your teeth, you palpate over here as part of the examination, and you feel that muscle contract. We also have the frontalis muscle here, which actually enables us to actually do part of raising the eyebrows. Because in CVA we've got dual innervation, if I had a CVA on one side, I would still get sparing of the forehead. Whereas, if I had paralysis coming in from one side, from the facial nerve, I don't have dual innervation, because only this side of the forehead is provided by this facial nerve, and that side of the forehead by that facial nerve. So if I have Bell's palsy, this side of the forehead will not be spared. So therefore, I will not be able to raise my eyebrow on this side. And if I'm not able to raise my eyebrow on this side, coupled with all the paralysis or the facial muscle, the labial fold being fallen, etc., therefore I have a facial nerve palsy, Bell's palsy. If, however, I have the facial paralysis, that is, but I'm still able to raise my eyebrow on this side, then that innervation is coming from there, and that dual innervation. Therefore, we have a CVA, an upper motor neuron lesion. And don't forget, lower motor neuron lesions are associated with peripheral nerves, which essentially is what Bell's palsy is, as compared to upper motor neuron lesions, which are confined and the pathological event is occurring in the CNS, i.e. the brain and the spinal cord. Appreciated cranial nerves originate from the CNS, but once they pass through the skull or certain areas, depending where they are, then they will be classified as peripheral nerves and therefore your lower motor neuron lesion. Thank you for watching.